Target Ovarian Cancer is the UK's leading ovarian cancer charity. Since 2008, we have been collaborating with primary care providers to drive progress in early diagnosis. Most ovarian cancer patients will visit their GP with at least one related symptom in the year before being diagnosed, and 41% will visit them several times before any investigation into ovarian cancer takes place. If ovarian cancer is diagnosed at the earliest stage, 9 in 10 patients will survive, but right now, 2/3 are diagnosed late. The NHS Long-Term Plan of 2019 set a target for 3/4 of all cancers to be diagnosed at stage 1 or 2, making early diagnosis a national priority in England. In 2020, we began the biggest early diagnosis project in our history, looking to promote best practice and help bring down the number of people who are diagnosed too late. From region to region, there are significant variations in the stage at which people are diagnosed. Among the CCGs that took part in our research, we found few differences in the core design of the patient pathway, and the GPs that we interviewed felt confident that they knew their local systems and reported few barriers in accessing investigations. However, we found some key points within the pathway where systems change could help GPs make ovarian cancer referral faster. Digital safety netting. One area where our research found significant variation was in the systems used for monitoring ovarian cancer symptoms and referrals. Some GP practices use electronic systems and templates to ensure patients are followed up appropriately. As remote consultations become the new normal and face-to-face GP appointments less common, the use of some form of digital safety netting like this is more important than ever. Systems can be used to prompt further investigation as an option whenever a patient presents with telltale or persistent symptoms, even if a doctor has never seen the patient before, or to serve as a reminder if a patient has failed to arrange or attend a follow-up appointment. Our research suggests more can be done to explore and embed the role of technology to stop people falling between the gaps and help CCGs and GPs to make best use of the systems that are currently available to support them. Recognition and referral. Some of the GPs we interviewed were particularly concerned about the possibility of symptoms being masked, especially in older patients or those with comorbidities. The symptoms of ovarian cancer can be quite similar to other conditions, such as IBS, so being able to recognize symptoms like these and for them to prompt referral for further investigation is extremely important. In some areas, rapid diagnostic centres are already acting as an additional pathway for patients with non-specific symptoms. We found that there are clear opportunities here for system improvements in supporting the nationwide rollout of rapid diagnostic centres and in ensuring that doctors are aware of this new patient pathway and feel confident in using it. Data and quality improvement. We also found that access to local ovarian cancer data for primary care was limited. A lack of data on ovarian cancer can make it difficult to measure the impact of quality improvement measures. Bringing people together from different organisations in order to understand how best to collate local data and to conduct a learning event analysis will be vital to identify possible opportunities for service improvement. From our findings, it's clear that no one thing can improve ovarian cancer diagnosis overnight, but that there are changes we can make at a system level to help tackle variation. That's why at Target Ovarian Cancer, we want to work with primary care teams and commissioners. We want to work with leaders across the system to develop and test innovative interventions that can improve outcomes for all. And we want you to talk to your colleagues and to think about what you can do to improve early diagnosis and to let us know how we can help you to implement change. Because by working together, we have the opportunity to lead the way and to make sure that early diagnosis is excellent everywhere.